Hello, today we'll look at the intramuscular injections that we can give patients who have schizophrenia as a disease. Why is this important? We have some indications and we will deal with some contraindications. Today in this video we will deal with the indications. That means why is it indicated to give an intramuscular injection rather than an oral tablet to a patient with schizophrenia? Let's see which are the points that we need. First of all, schizophrenia needs to be diagnosed. That's the first rule. You cannot give intramuscular injection to patients who you are not really sure that this patient has schizophrenia. First step. Second step, you need to treat schizophrenic patients with oral tablets before you start any intramuscular injection. You're not allowed to give intramuscular injections before you know that the side effects of the antipsychotics are not there for this type of patient. So a patient comes, he has schizophrenia, you give oral tablets. Usually you give oral tablets for several weeks before you even consider giving any intramuscular injections. Why? Because the side effect profile, as we said. Some will have extrapyramidal symptoms. We dealt with all these type in other videos. That means we can have severe side effects of antipsychotics. And therefore we start with the lowest dose of antipsychotics. We titrate it up to a good and stable level. That means that we have a good response. The schizophrenia disease is getting less. The psychosis is less. The agitation is less. The hallucinations, delusions are less. And we have the lowest dose possible that is achieving this good response. Why? Because in the other end, when you increase the dose, you get a lot of side effects of antipsychotics. So you need to have the balance of a good response, but at the same time, less side effects. And therefore we start with the lowest dose, titrate it up until we reach a good response. And we see there's no side effects. Now we have this patient with no side effects. He's taking the pill every day, and we consider now an intramuscular injection. So now we will give the intramuscular injection, but before we do that, then we need to check which are the indications for it. And this is what we deal with today. First of all, diagnosis has to be schizophrenia. Second, the patient usually are having a bad compliance. So the patient has a bad compliance. This means that he is not taking the oral tablet as he should. He's stable on the oral tablets. As we said, this is a requirement. This is an indication for intramuscular injection, being stable on the antipsychotic that he's taking already every day and having low side effect profile, so low side effects. Then, if we see that the patient is not taking the pill, so he has a bad compliance, then we need to consider intramuscular injections. Why? Because then we don't need to rely on the patient taking the pill every day, because we give an injection and then every 4 weeks we give another injection. So it means some intramuscular injections can be given every month, so 4 weeks. Some can be given 6 of the 6 weeks, of the 8 weeks, even 12 weeks. So we have injections that we can give every 3 months. This means that we give an injection 4 times yearly. That is convenient, or? I mean, if you compare that to taking a pill every day, so it means 365 pills a year, or you compare it to only take 4 injections a year, so you don't have to think about it. You don't have to remember it. You go on a vacation, you are working, you forget to take the medications. You don't need to remember it because the doctor will give you 4 injections a year. This is the advantage of intramuscular injections, one of them. The other advantage of it is that the level of the medication will be stable, more stable, because when we take oral medication, it can fluctuate depending on your body composition, depending on your daily stress activities, on your work activities. Sometimes you're training a lot, sometimes you're exhausted, sometimes you didn't sleep enough, sometimes you didn't drink enough of water, and so on. Your kidney function is not working as it should. That means it's a lower function because you drink less water, then the urine function will be less. If the urine function will be less, then the dose will be higher in your body because medications, oral tablets, are excreted through the urine. And if you have a low urine function, then you have a high dose in your body. And as you see, a lot of factors can influence the dose of the medications. That means some days you will have a high peak of this medication, of these antipsychotics. And if you have a high peak, a high dose, you will have then higher risk of side effects, more side effects. And therefore, when we give intramuscular injections, it is stable. You only give it once, and it will last for 4 weeks, or it will last for 3 months, and it is stable in your body. So that's advantage. So we have criteria, indications of intramuscular injections being, please have a diagnosis, please have a stable level already reached with oral tablets, please then have if you have a bad compliance, that would be an indication. If you have a patient who has intestinal problems, for example, he had surgery, some parts of his intestines or his stomach was removed. Of course, then the intestines and stomach and so on cannot absorb the medication, the oral tablets that you take. Then we need to consider intramuscular injections because we need to absorb it somehow. And absorption, we call it malabsorption when it's bad. It's mal, it's bad. Bad absorption means we need to have intramuscular injection. Again, the same thing with the peak level. Peak level should be stable, and that is achieved with intramuscular injection. So I would say these are the main indications. Of course, we have also treatment-resistant schizophrenia. That means we give oral tablets. It is stable, but the patient does not really benefit from it. It's more resistant to it. So it means we continuously need to increase the dose of this oral tablet. And therefore, sometimes we don't know if the patient is actually taking the pill or not. So the compliance is so questionable. So we give an intramuscular injection and then we will find out why. Because when we give an intramuscular injection and we see that the response is good, then we know that actually this patient did not take his medication as he should. He said that he did. He said that he was a really honest and he takes the medication every day. But we saw that it was a treatment-resistant schizophrenia, meaning the response of the medication was not so good. And instead of just removing that medication and switching to another medication, we tried the intramuscular injection and we saw that, it's working. It's working better with the intramuscular injection. That means he didn't take the pill as it should. Okay? And then you can communicate with the patient that we will give now an intramuscular injection because it is more convenient for you. You don't need to take a pill every day. You can only take this injection, or you will be given that by the doctor every 4 weeks or every 3 months, and then you're fine. You have a better response, less side effects, and so on. Okay? So once again, indications of giving intramuscular injections are diagnosis of schizophrenia, any type of bad compliance that is leading to bad behavior and then self-harm and then arrest by the police or assaulting someone. So the schizophrenia disease is getting worse. So delusions, hallucinations, and so on. This is an indication. The third indication is we want a more stable level because we see that the side effects are some days very strong and some days less. So it's fluctuating too much. We need this more stable level. Then there are patients with intestinal problems or gastrointestinal problems, meaning the absorption is bad, malabsorption we call it. Then we need to give it. Or that we see simply that it's a treatment-resistant case. Regardless of how much dose we give, somehow the patient does not get it into his body. So it means probably he's not taking the medication. So once again, bad compliance. Okay, thank you very much for listening, and I hopefully you will now understand why it's so important to give intramuscular injections in schizophrenic patients. Thank you very much. Bye-bye.